Hi there. Thank you for joining me once again on the program, Your Doctor in COVID. I'm Dr. Mahendra Carpen. I'm the head of medical services and cardiology at the Georgetown Public Hospital Corporation. We continue to speak about the COVID-19 pandemic, the devastating effects it has been having on our people in Guyana and our neighbors in the Caribbean, as well as across the globe. As we speak now in the end of May 2021, we are in the middle of a surge or a second wave, not just in Guyana, but in a lot of our neighboring territories like Trinidad and Tobago and Suriname. Remember, if you have any questions or comments, please feel free to send a WhatsApp message to 620-6275 or send an email to docandcovid@gmail.com. I'm starting out today as usual wearing my mask firmly to cover my nose and mouth, and I will take it off using the straps around my ears so we could continue this conversation. We are in the midst of a deadly surge of COVID-19, and it's affecting us all. As we speak, there are over 300 Guyanese families that would have lost at least one loved one to COVID-19. And it has touched us all in a way that we have not seen before in diseases or in medical matters. Most of us would actually know someone who would have had COVID-19, recovered from COVID-19, or been in hospital for COVID-19. If it didn't happen to us, specifically or individually, we know someone that would have experienced this. And this is no joke. This is not something to be taken lightly. People are dying of this disease all across the world. And particularly close to us, people are dying in our towns, in our villages, in our neighborhood. So it's important for us to take it seriously and take all the measures that have been recommended to keep us safe. And these measures are the simple ones and some that involve personal choices. The simple methods and the simple measures that have been recommended are things like always wearing your mask, and ensure that you wear the mask correctly to cover face, your nose and the mouth. And the next thing we need to do is to continue to practice social distancing. Stay at least 6 feet away from persons, especially those who are exhibiting symptoms or those who do not normally belong in your usual regular social circle, especially when you're out of the house. And the other thing is to sanitize, wash your hands, keep them clean at all times. Remember, you may unconsciously touch surfaces, open doors, rub countertops, etc. And these are all potential sources of the infection. Even though the CDC has declared that this is mainly an airborne virus, we can still get disease transmission from surfaces. So it's important for us to recognize early symptoms, to recognize complaints, and when you go to take COVID vaccines or when you go into places, there's often a questionnaire and a set of questions that people will ask to ensure that you're not exhibiting any symptoms or signs of an active COVID-19 infection. And some of these questions are quite simple and straightforward. And so you should not be surprised if you were to go into a place of business, for example, and they ask you, have you been in contact with a confirmed case of COVID-19? As we get past 16,000 cases of COVID-19 in Guyana, it is quite possible that many of us would have come in close contact with someone who would have had COVID-19 either recently or in the past. People also want to ask you about your symptoms, if you have any symptoms. And they may ask you, are you experiencing any cough? Are you having any shortness of breath? or are you having any sore throat? Now, in times gone by, all of these things could have been seen in a normal flu. But in the era of COVID-19, we no longer assume that these symptoms are only attributable to the flu. But our first thought, our first instinct is to think about COVID-19. Are these symptoms due to COVID-19 or is it something else? So we approach these symptoms as if it's due to COVID-19 before we think about any other thing. The actual hallmark, landmark type of symptom that we ask people for is, have you had any fever? More particularly if you've had any fever in the last 48 hours. Because persons can have a cough, they may even have shortness of breath from things like asthma or allergies, but fever makes it more likely to be an infectious source. And infections can be bacterial, can be parasitic or viral, and sometimes, rarely, it can be fungal. The one that we are concerned mostly about in this time is the COVID-19, the viral infection. The main symptom that people with COVID-19 complain of is fever. So it is not unusual to ask or to be asked, have you had any fevers in the last 2 days if you're going into a place of business or if you're going to a place of work, etc. The other question that people may encounter is, have you had any loss of taste or smell? This is a very peculiar feature of COVID-19, the loss of taste and smell. We have seen this occurring, but thankfully, the majority of persons who would have had loss of taste and smell would recover this function. They would recover taste, recover smell by the end of 1 month or 28 days. And that is true for the majority, about 98% of all persons who have this symptom or these symptoms of COVID-19. There are a number of persons who actually only know that they should be concerned about COVID-19 when they're noticed that they can't taste or smell properly. And so this may be their only complaint, the only indication that they have COVID-19. The other main question that you can encounter is, have you had vomiting or diarrhea in the last 24 hours? COVID-19 can be transmitted through the mouth and the gastrointestinal tract. So it is not unusual that it can affect the organs from the mouth to the stomach, the intestines, etc. And the symptoms associated with any abnormalities of the gastrointestinal tract usually involve things like vomiting, diarrhea, nausea, abdominal pain, etc. When you have these symptoms in combination with fever or recent cough, shortness of breath, etc., it is very suspicious and one has to look for the COVID-19 infection. The other question that people may encounter is, have you had a recent COVID test and are you awaiting results? And if you did have a COVID test recently, people may want to know why you had the COVID test. Is it because you have symptoms, or is it because you are expecting to travel, or is it a requirement for conducting business? Many countries now, the majority I believe, require negative COVID test for you to enter that country. So if you're going to go by air travel or sea or land and you're crossing borders and you're entering into a different country, it is quite likely and expected that you would have to produce a negative COVID-19 result. So we need to understand a couple of concepts. We talk about SARS-CoV-2 or the COVID-19 virus, And that is actually the name of the virus, SARS-CoV-2 or COVID-19 virus. COVID-19 is the name of the disease that this virus produces. COVID-19 is the name of the disease. And coronaviruses are a family of hundreds of viruses known to infect birds and mammals. And COVID-19 is a member of this viral family. So there are several coronaviruses, hundreds. COVID-19 just happens to be one of these coronaviruses. We have encountered diseases caused by coronaviruses before. The MERS, or Middle Eastern Respiratory Syndrome, was seen before. The SARS, which was seen mainly in Canada and some countries in the 2008 thereabout, these have been known to be caused by coronaviruses. In fact, when the MERS outbreak occurred, it affected 28 countries. SARS affected 29 countries. COVID-19, caused by a similar coronavirus, has spread to over 175 countries. 175 countries across the globe, compared to others that didn't meet 30 countries. The fatality rate, and this is data from March last year, the fatality rate from MERS was 34%, from SARS 9.6%, and from COVID-19, the fatality rate across continent is between 2 to 3%. In Guyana, the fatality rate is about 2.2%. The number of cases seen across the world for MERS was 2,494. For SARS, we saw 8,096, and as of March 2020, there was about 500,000 cases of COVID-19. We know that that number has grown significantly since then. In fact, now from March last year to now, end of May 2021, we now have almost 170 million cases of COVID-19 across the world. In terms of deaths, we had 858 persons dying from MERS, that is Middle Eastern Respiratory Syndrome. We had 774 persons dying from SARS, and as of May 2021, we have over 3.5 million people dying from COVID-19. So COVID-19 is a much larger scale of an infectious disease. And even though the death rate or case fatality rate is less than those previous coronavirus diseases, the sheer numbers have been massively more, significantly more than combined MERS and SARS. Coronaviruses cases across the world have been recorded to be 169,270,000. The number of deaths that have occurred due to coronavirus, COVID-19, is 3.5 million. And luckily we had over 150 million persons recovering from COVID-19 infection. If we look at what's happening between Guyana and Trinidad, our closest neighbor in the Caribbean, we see in Guyana we had so far 16,556 cases. We had 374 deaths and 14,000 persons recovered. Our neighbors across the Caribbean Sea in Trinidad have recorded 21,400 cases with 425 deaths, the vast majority of these occurring in the month of May 2021. And luckily they had 12,000 people that have recovered already from COVID-19. So we see that COVID-19 continues to be a major problem, not just around the world, but closer to home in Guyana and in our neighbors. And it has been a devastating disease so far, and all we can do is to make sure that we continue to follow safe practice guidelines such as wearing a mask, sanitizing and maintaining social distancing. And once you have the vaccine available to you, you should take the vaccine as well. So I want to thank you again for joining me, and remember, if you have any questions or comments, please feel free to send a WhatsApp to 620-6275 or send an email to docandcovid@gmail.com. Thanks for joining me.